Hello friends, Sarah here from the Centre for Mental Health, and well, I, more than any other time that I've ever said and used this line, I really do hope all is well. I don't even know where to begin really, even in the very short time since we published our last video just 7 days ago. So much has happened, and I think it's fair to say that the majority of us are probably still trying to make sense of the most recent announcement by the Prime Minister, saying that effectively all unnecessary travel outside the home was prohibited. It's like, I guess, a time none of us have ever experienced. I don't think there is no real recipe for this. And I think we as individuals, organisations, are really trying to wrap their heads around a new way of working, a new way of relating to each other, a new way of doing their work, of literally everything, eating, shopping. Our lives are all up in the air. And to be human means that we feel anxiety, fear, and all of those are absolutely reasonable responses to what's going on right now. I guess, as I said in my last video, we're really worried about those people who already are unwell. What is happening to those people who are already living lives fraught with anxiety and despair? So I guess, while we talk about staying well, we really must remember that all of the things that we usually say and encourage people to do might not be available to some of us. So if you're someone with a long-term condition that's on the list of vulnerable people, it might be very difficult for you to leave your house at all over the coming months. And I think we mustn't underestimate the psychological impact that this is going to have on all of us. Even if you're mentally well now, it is likely that you will certainly experience low mood, anxiety, and worries about all sorts of things over the coming weeks. We at the Centre have provided information and resources on our website, and it's pinned across all our landing pages on our social media. And this is with all sorts of information, signposting, places where you can go to get absolute clarity on things. Of course, we're not going to repeat that information because we don't want things to get lost in translation. I guess one of the other things that we really wanted to kind of highlight is now that hundreds and thousands of children will be at home, parents will be trying to teach them, will be trying to manage their fears and their worries, our own fears and worries. And we will want them to stay integrated with their friends. And there are things that we need to consider. The Children and Young People's Coalition has published an extraordinary briefing that covers a range of issues, a range of really important issues that cover education, home lives, safety. It's going to be important over coming weeks for parents and children to work harder on their well-being, for us to not only focus at home on homeschooling and resources we might need to get them through their last few months of the term or of the year, but also really, really hold in mind that our children and young people's well-being at this moment in time, without help and support, will be fragile, there's no doubt. We must be able to give them clear information. We must manage the amount of news that they're consuming. We must make sure that the contact that they're having with friends continues to be supportive and safe. We're obviously concerned about cyberbullying when more kids are going to be online now than ever. We really want children to be able to exercise and really finding out locally for you how you can make that happen. We really want children to maintain those relationships, and how do they do that now? So I think over the coming weeks we'll continue to provide information, but I guess this is just a acknowledgement really and a handout to all of our friends And to those people who are looking to us for advice and guidance over the coming weeks, what we as a team want to do is really analyse what's happening in society, how people are feeling psychologically, and please make no mistake that we are taking all of our intelligence, our information, our expertise to the highest level so that your mental health needs will continue to be met. It's not going to be easy, and our concern continues to be for the most vulnerable in our society. We are concerned about those people who are living in poor accommodation, who might not have the resources to work out how to homeschool their children. So from the Centre for Mental Health to you, I wish you all the best, and please stay in touch with us. We care about you, and we're going to do our best to provide you with good information, but we also will do our best to make sure that we share your stories. And a kind of last word really, be kind to yourself. We need to manage our expectations of what we can achieve in this time. So I leave you with lots of love, and see you next time.